Hello, this is Dr. Gary from First Look MRI, and this is an example of a bucket handle tear of the medial meniscus. So this patient has pain and locking in the knee. A recent injury caused this. She has a normal appearance of her lateral meniscus, which is a little black wedge here. Fits between the lateral femur and tibia. So this lateral side of her knee joint looks good, but the medial side is abnormal. You see the bone is kind of scalloped here, a little bit of spurring, and the bone is dark. And the meniscus, instead of a nice triangle, we see just a little vertical band here, a little meniscus remnant. And the meniscus is displaced into the knee, and this is a piece of that meniscus. So a large, what we call bucket handle tear, and this meniscus fragment is here instead of over here. And now we'll put up another view where fluid is bright and fat is suppressed. All the marrow is dark. Now this really stands out, the problem here. We see marrow edema, which has had bone impaction injuries, maybe some developing degenerative changes. We see the meniscus, that little vertical line is a little maybe piece of the peripheral rim, but most of the meniscus is right here in the middle of the knee. So a large inward displaced bucket handle tear above the tibial spine here, this big fragment. This is called the posterior cruciate ligament, normal ligament in here. We see the big meniscus. And absent is the ACL. We should see the ACL here, but it's not here. So unfortunately, she also has an ACL tear. Now we'll look at one more view to see the same stuff here. This is a sagittal view. We see the PCL, which is intact. And it looks like we have a double PCL. But this second PCL here is actually the large bucket handle fragment. This is the piece of meniscus that's flipped into the middle of the knee joint here. And that'll cause knee pain, locking, instability. So these have to have surgery for them to be able to move. The ACL we should see going through here, but instead it is absent. The ACL will be a dark band coming from the back of the femur to the front of the tibia. So ruptured ACL, large inward displaced bucket handle fragment, complex tear, and also this significant bone injury as well. Thank you very much.